Welcome back. Let's take a look at the blood flow to the brain. The brain is important, but it can only function if it's getting glucose and if it's getting oxygen and its nutrients. So how does glucose and oxygen and all the nutrients get up to the brain? Remember, we have the blood-brain barrier, which is the astrocytes, very important. Blood flows to the brain from major vessels that come off the heart, right? So you have the heart down here, and we're going to have some branches coming off of it, specifically the vertebral arteries and the carotid arteries. So they're going to bring blood and oxygen and nutrients to the brain. And after all the nutrients and oxygen are there, we're going to drain it by the jugular veins. Okay. And in order to bring blood and glucose to the brain, we can see that we have your vertebral arteries, one on each side. And then the vertebral arteries come up and form the basilar artery. And then there's a circle in the middle. That circle is called a circle of Willis. And off that circle, there's some major arteries that go to the anterior cerebrum. There's some arteries that go to the middle cerebrum. There's some arteries that go to the posterior cerebrum, and the arteries that go to your cerebellum. But this circle is really, really important. It's called the circle of Willis. So this would be a vertebral artery down here. This is another vertebral artery. They converge to form the basilar, and then there's this circle. So even if this vertebral artery is blocked and occluded, blood can come up from this way and still find a way to get everything. Right here is the internal carotid on this side. If this internal carotid is blocked, we could still find the way to get blood up and can come around this way, can come around this way because of this circle. It's called the circle of Willis. Okay, when we get into blood supply and we get into the arteries and veins, it'll be more important to understand the circle of Willis. Okay, but you could see it underneath. This is a bottom view of the brain. Now, strokes can happen not so much in these large blood vessels, but if you have something that's a large plaque or calcium from here, and then all of a sudden it starts to move and hits a smaller artery, that's when you start to get these obstructions, when it hits these much, much smaller blood vessels. Okay, and that's where some of the blood thinners come into play, is if there's an obstruction, blood thinners serve the purpose of trying to sneak and squeeze blood through an occluded area. Okay, but that's only helpful if it's a thrombus. If it's a thrombus or a blood clot, blood thinners come in handy. But if a stroke is as a result of a dissected artery, like a ruptured artery, taking blood thinners can kill the person. Okay, so in terms of blood flow, the brain's going to utilize about 20% of the body's oxygen. So any interruption of the oxygen supply can result in weakening, permanent damage, or death of brain cells. And glucose deficiency, okay, that can produce mental confusion, dizziness, convulsions, and even unconsciousness. So we always want blood sugar, we always want glucose, and we always need oxygen. Neurons, in order to function, they need glucose, they need oxygen, and stimulation. They always need stimulation, oxygen, and glucose to function properly. And let's remember about the BBB, the blood-brain barrier. It protects the brain cells from harmful substances and pathogens, and it serves as a selective barrier to prevent passages of many substances from the blood into the brain. But that can be a problem because it can prevent the entry of therapeutic drugs. So they try and find tricky ways of getting therapeutic drugs into the brain by sometimes trying to disguise it in a high sugary solvent They figure maybe if we can sneak it in with glucose, then we can get that drug into the brain. All right, injury to the brain can cause a breakdown of the blood-brain barrier, and it can permit passages of normally restricted substances into the brain. So that BBB, the blood-brain barrier, is very important. There's a condition that's called leaky brain syndrome. Leaky brain. It's very similar to leaky gut syndrome. Okay.